All right. So, good afternoon, everyone. And on behalf of OCI, I warmly welcome you all in today's educational session on choosing the right lens, with the proper material, modality, and patient profile. So, the contact lens practice today's, it goes far beyond simple refractive correction. It requires a thoughtful understanding of lens materials, wearing modalities, and most importantly, aligning these choices with individual patient needs and lifestyles. So, this session aims to bridge that gap between the theory and real world clinical decision making. And we are delighted to have with us Mr. Prashant Pawar. He is a dynamic optometry professional currently serving in Professional Affairs North region at Cooper Vision. He brings a well rounded experience in the vision care industry with a strong foundation in clinical practice, retail optometry, and corporate engagement. He holds a bachelor's degree in optometry and has further specialized with a fellowship in optical dispensing from the Indian Optometry Association. Prashant has gained extensive experience working with leading organizations such as Lens Crafters, Lenskart, Owndays, and Zeiss, contributing to his strong industry perspective. With his diverse exposure and passion for advancing optometry practice, he continues to play a key role in professional engagement and knowledge dissemination within the field. So I'm sure he will bring valuable clinical insights and practical experience in contact lens practice, and his expertise will guide us in making more informed and patient-centric choices in our daily practice. So, and definitely, we would also like to sincerely acknowledge Cooper Vision India for their continued support and in strengthening academic learning and professional development initiatives with OCI. So, without further delay, I invite Mr. Prashant Pawar to take over the session. Welcome, Prashant.
Thank you. So, first of all, thank you very much for such an introduction about me. And basically, thank you very much for giving me an opportunity to present in front of so many optometrists. So, I'm seeing we have almost 45, 47 candidates attending this session. And as you have mentioned, the main agenda of today's presentation is to understand the modalities, how we can select a perfect contact lens, how we can identify it, and how we can approach it for our patient. That's what we are going to cover in today's presentation. So, good afternoon, everyone, and I'll just share my screen, then we'll start. I hope my screen is visible to everyone.
Yes, yes, it's visible. Yeah.
Okay. So great. Let's start with today's presentation about choosing the right lens with the help of by choosing a better material, by choosing or selecting a right modality and selecting a particular patient profile. But before that, today I'm representing a Cooper Vision, and I would like to start with by introduction of Cooper Vision. So if I talk about Cooper Vision is actually a part of Cooper Companies, which was established in 1958. So we have three segment in Cooper Companies. First is Cooper Vision soft contact lenses, where we specifically deal with the soft contact lenses portfolio. Second, we also have specialty eye care departments, which specifically deal with specialty contact lenses like RGB contact lenses, scleral, or ortho K contact lenses. Then globally, we have Cooper Surgical Department also, which is specifically dealing with women healthcare devices. So if I have to give a glance of Cooper Vision or just an overview of Cooper Vision, the Cooper Vision is the number one company across Europe. Then we are global leader in toric contact lenses. So the technology or the toric stabilization technology we have, it's more stable if we compare with other stabilization design, and that's why we get title of global leader in toric contact lenses. Third, I'll just highlight Cooper Vision is a technology-driven company, and I'll give you a simple example. So, if you heard about myopia control, nowadays myopia control spectacle uh, is in practice, a lot of in practice. But Cooper Vision is the company who has manufactured first myopia control contact lenses by the name of MySight. And this contact lenses for the myopia control segment, it's available in Europe since 2011. Second, if I talk about Indian market, you majorly have heard about the color contact lenses, prescription contact lenses, but we have specifically a lifestyle contact lenses, which is Biofinity Energies. And these contact lenses are available in Indian market as well. So Biofinity Energies is specifically manufactured or specifically made to reduce a digital eye strain of today's users who are using a computer or digital devices for more than 8 to 10 hours. So that's what specialization we have in Cooper Vision. Apart from that, if I talk about power availability, so if you observe the major global brands, they have power availability from -12 to +12, or the cylindrical power till 2.75. But Cooper Vision is the widest manufacturer of prescription option. So I'll give you a simple example. We have highest power available of +20 to -20 diopter in spherical with 5.75 cylindrical at 55 degrees step axis availability. So I'll give you a very simple example. We have around 8,50,000 SKUs in lens prescription option. So you can imagine how much different power availability we have. So this power availability enables you to cover your 99.96% of patient to shift toward contact lenses. Uh, Even the high power patient, for example, the power of +18 with -3 cylinder, -4 cylinder, we have option in Cooper Vision as Biofinity XR Tori. Then if I talk about global distribution of Cooper Vision, we sold 3.5 billion contact lenses annually in 130 plus countries. And its Cooper Vision is available at 6 continents. So that's just an overview about Cooper Vision, what Cooper Vision is, and how we carry a specialization in power, specialization in technologies. Now I'll go ahead with the selection of contact lenses. So as we all know, while selecting a spectacle lenses, we have multiple options. We select the dia, we select the index option, we check the power. We have option for spherical lenses, freeform lenses. So when I talk about contact lenses, what parameter we should look at to select a ideal contact lens or perfect contact lenses for today's patient? So I'll start with a simple discussion. The most important parameter for today's lifestyle in any contact lenses is dk by T. So dk by T simply represent how much oxygen the contact lens pass through it. So uh, anyone guesses what is the minimum dk by T is required for to consider a contact lenses as an healthy lens wear?
35 dk by
Anyone?
t 35 dk by t
Okay, great, Atip. So, if I observe the previous criteria, so previous criteria was Holden and Merz criteria, which states that 24 dk by T is sufficient to consider a contact lens as a healthy lens wear option, and it is specifically for open eye condition. But later on, Havitz and Bonanzo criteria, it suggests that the dk by T is 35. The minimum required dk by T is 35 just to consider a contact lens as an healthy lens wear option. So whenever I'm selecting a contact lens for my patient, I'll first observe what dk by T it carries. And believe me, majority of hydrogel will even not fulfill the previous criteria. The DK by T is varies from 19 to 26. So the first thing I'll observe what DK by T specific contact lenses have. Then second criteria, I should look at is the water content of contact lenses. So water content affects the initial comfort or wearing comfort of contact lens as well as better on eye movement. So if I have to select a contact lens for my patient, I look at the contact lens at least have water content more than 45%. So 45% water content, more than 45% water content enable me to provide better comfort to my patient. And specifically, not only water content is sufficient, but with water content, the contact lens should have moisture lock technology. Because of that, so my end of the day comfort will be better. So water content and moisture lock technology is my second criteria I should look at while selecting any contact lens to my patient. Third criteria is the modulus. So if I have to simply explain modulus, modulus denotes how flexible my contact lens is, or in simple term, how soft my contact lenses is. So in spectacle lenses, we have option for index. So as index is increases, my spectacle lens thickness will get reduced. It is opposite in contact lenses. In contact lenses, lower the modulus, more softer the contact lenses. An ideal contact lens should have at least modulus less than zero point 0.8. So the zero point 0.8 or zero point 0.7 modulus helps me to get better handling. At the same time, the lesser modulus helps me to more soft contact lenses to provide me a better comfort. So third criteria, I'll definitely look at the modulus of contact lenses or how soft my contact lenses. So my patient will get more comfort even at the time of wearing. It is easy to handle as well as it is easy to remove. Now, fourth and fifth criteria, I'll say it is dependent on each other. So first, the contact lens surface should have hydrophilic surface, a water loving surface. At the same time, it has lesser or lower contact angle. So this will help whenever I'm wearing the contact lenses, the tear film, it will get attract over contact lens surface. At the same time, it will spread over the contact lenses. And this surface property, it's most important, I'll say, because of it enhances your overall comfort uh, throughout the day, as well as it reduces the chances of deposit. So deposit resistance properties also depend on the surface property of contact lenses. So I'll just do the revision once again. To select a best contact lenses for my patient, I'll first look at DK by T. It should be more than 35 DK by T if I have to dispense it for 8 to 10 hours of uses. Second, water content. So the ideal contact lenses have water content more than 45%. So it will enhances my overall comfort as well as if a specific contact lenses have moisture lock technology or moisture retention technology, then this will enhance my end of the day comfort as well. The third criteria I should look at is the modulus of contact lenses, how soft the contact lenses are. And ideal contact lenses have modulus less than zero point 0.8. And last, I'll look at surface property. So I'll go ahead towards the next topic. But before that, I would like to just highlight one point. Basically, tomorrow on 15th April, we have World Contact Lens Day. And any guesses, anyone, why we are celebrating a World Contact Lens Day on 15th April only? Why not any other date? Any guess from anyone? Why it is 15th April only? Even you can write it on chat box also. Okay.
I think
I'll start in
about it, yeah.
yes. Someone is saying I'm unable to
No, I
hear.
think participants doesn't know why.
Yes, yes, I can understand. It is also recently I get to know. So basically, I think everyone knows the Leonardo da Vinci. famous painter who have painted the Mona Lisa's painting. So he is the person who has given the concept of contact lenses. And that's why on his birth date, we are celebrating World Contact Lens Day. So even for the Leonardo da Vinci's, it is a small story. I would like to tell the story. So as per story, Leonardo da Vinci has small refractive error. And he observed that whenever he is swimming inside the water, his vision is getting more clear. And that's how he thought, if I create a layer of water over my eyes to correct my vision, that's how the concept of contact lenses comes into a picture. And this concept came around the year of 1568 or 1550s. Now, imagine the concept has started at 1560s around. After that, the hard contact lenses got invented. Definitely, everyone knows the RGB contact lenses or the hard contact lenses. Now, the major problem with hard contact lenses is that those are not comfortable at all. Those correct the vision, they gives a better clarity, but those are not comfortable at all. And that's how hydrogel lenses came into a picture. So around the year of 1965, actually two Japanese scientists invented a material which absorbs water and get more soft. And in 1971, the official hydrogel lens material got patented. Now, believe me, hydrogel lens, it has better water content. It is more soft. The modulus is very low. The contact lenses of hydrogel are highly comfortable. If I have to wear, my initial comfort is superb. But the problem with hydrogel, so later on it is observed that hydrogel, the pervaporation of water content is also high. And because of that, if I have to extend my hydrogel contact lens wearing time, it will not give me the better comfort. My end of the day comfort is very less in any hydrogel contact lenses. Second, it is also observed that the hydrogel contact lenses, the decay by T or oxygen permeability is very less or very minimal. And that lead to hypoxic condition if I'm using hydrogel contact lenses for longer years or longer duration of time. And that's why it is required in market to create a healthy contact lens wear option, which is more comfortable as well. And that's how silicon hydrogel came into a picture. So, silicon hydrogel last year only at the year of 2025, silicon hydrogel has celebrated their 25th birthday. So, silicon hydrogel was actually invented at the year of 1999 to 2000. Now, imagine why silicon? Why not any other material? The two main reason for it, silicon is hypoallergic. It does not react with any body part. Second, silicon is, I'll say it passes more oxygen through it. So that's the two reason why silicon is got selected to provide a better health. I think someone is drawing on screen. Uh, okay, great. I'll just continue. So that's why silicon is specifically selected. Now, when the first silicon hydrogel was invented, the major problem of silicon is hydrophobic in nature. So I'll give you a very simple example. The best example of silicon is nose pad available at our stores, at our opticals. So if I observe nose pad, if I put a water droplet over it, believe me, the water droplet will not stay, it will float because the silicon is hydrophobic in nature. Now imagine a material of hydrophobicity like oil combining with water molecule. It's again much difficult task. Somehow scientists has developed or incorporated a water content inside the contact lenses, inside the silicon hydrogel. But the major problem is the surface property because or the major problem is wettability Because the silicon, the surface is hydrophobic in nature. Now, when the first silicon hydrogel was invented, we call it as a first generation of silicon hydrogel. Now, just to reduce this surface property or the surface problem, what they have done the surface modification. Surface modification means they put the contact lenses into a gas plasma chamber where, with the help of ion bombardment, the silicon is changed into a silicate molecule. Now, these silicate molecules are hydrophilic in nature. So, my overall comfort over the contact lenses, it become better with first generation. But in first generation, the major agenda or major focus is toward create more decay by T contact lenses. And that's why they have added too much amount of silicon in contact lenses. Because of that, if I have to look first generation of silicon hydrogel, they have high modulus. The modulus around 1.1 to 1.4. So the difficulty is if I have to shift hydrogel user towards silicon hydrogel, the first generation, because of high modulus, they'll not get comfortable when I'm shifting toward first generation of silicon hydrogel. That's where the second generation comes into a picture. So in second generation, they have reduced overall modulus of contact lenses towards zero point 0.7 to zero point 0.8. And for the surface property, to make the contact lenses more weightable, they have added weighting agent. So if I have to explain weighting agent, weighting means the chemicals which makes contact lenses more weightable. They have added this specific chemical into a contact lens solution. Now, whenever I'm dipping a contact lens into a solution, this weighting agent creates a layer over contact lenses, which enhances my overall comfort of contact lenses. Now, this is a very good concept to enhance the overall wettability. But the problem is every contact lenses require different weighting agent, and each weighting agent is not available in every solution. And that's why we call it as a solution dependent contact lenses. That's where the third generation of silicon hydrogel came into a picture, or we can call it as a naturally weightable contact lenses came into a picture. So here, rather than using a surface treatment or rather than using any weighting agent, what we have done, we have used a longer silicon molecule. Now, this longer silicon molecules, they pass more oxygen through it. The modulus is very low. At the same time, we selected a specific silicon which has hydrophilic group attached to it so that the contact lens become more wettable, more hydrophilic, and that's why third generation of silicon hydrogel, if I have to observe, they have better decay by T, they have lower modulus, they have naturally wettable surface without dependent on any wetting agent or surface treatment, as well as if I have to observe the overall comfort, they have better comfort. And that's how third generation came into a picture. So in simple sentence, if I have to differentiate the generation of contact lenses or the development happen into in contact lenses, the first is surface modification dependent on the surface treatment. Second is the weighting agent dependent, which are dependent on the solution. And third, which are naturally wettable, which comes with inbuilt material based property. So it is same as spectacle. We have coating based spectacle lenses where we are providing specific feature with coating like UV protection, blue light protection. Other, we have material based spectacle lenses where we are providing the same feature with material based property. So same way, naturally wettable or third generation of silicon hydrogel comes with a material based property. Now, the benefit of material based property is we'll get the same comfort and same benefit throughout the day as well as from the first day to 30th day. That's how the silicon hydrogel goes through a different generation and different development. Now let's understand this is how we have understand how silicon hydrogel came into a picture, how it developed, how hydrogel came into a picture. But what is essential for today's lifestyle? And if I have to consider the today's lifestyle, believe me, the today's lifestyle is very different than 1971 or the year of 2000. The today's lifestyle is more active, or specifically if I have to speak, we have majorly mixed lifestyle. And because of this mixed lifestyle, we have to select a specific contact lenses which fulfill my need of today's lifestyle. Now, what are the need of new lifestyle or the changing lifestyle? So I'll start with the simple statement. In today's lifestyle, our patients are demanding more. They require more. They need more comfort. They need a longer wearing time. They need a healthy contact lens option rather than specific comfortable contact lenses. So if I have to check for the study, over a third contact lens user using their contact lenses for more than 14 hours. And that's the genuine scenarios. Because nowadays, if I have to check for the lifestyle of the patient, they are traveling for 1 to 2 hours in the morning. Then they are attending the office. They are sitting in the office, working there for 10 to 12 hours. Then again, they are traveling back for 2 to 3 hours. So overall, my contact lens uses duration is more than 14 hours. And believe me, the hydrogel contact lenses does not fulfill this requirement. Hydrogel contact lenses are actually made to use only for 6 to 8 hours. If I have to extend, I can extend it for maximum by 10 hours, not more than that. Even it is observed that 75% of consumer used to nap with their lenses. Let's assume if I'm traveling for my office for 2 hours, definitely while traveling, I'll take 15 minutes of nap. And that's why the selecting of DK by T or water retention technology, both things are important while dispensing the contact lens to the newer patient or today's generation patient. At the same time, 75% of contact lens user, they like to upgrade their contact lenses for better comfort and better health. And that's what the requirement of today's lifestyle. Now, how we can fulfill this today's lifestyle? So first and most important, I'll start how to select material for today's lifestyle. Definitely, if I have to use the contact lenses for more than 10 hours, I'll go for silicone hydrogel contact lenses only. And that's what my first preference for any patient. Because I don't want my patient compromise with the oxygen permeability. After 5, 6 years, they lead to hypoxic condition. That's why my first most priority is to select silicone hydrogel material. Now, I'm not saying that the hydrogel contact lenses are bad, are not useful for today's lifestyle. Let's assume someone having a lifestyle who want to use the contact lenses only for the jogging or only at the time of gym. He want to use the contact lenses only for 2 to 3 hours. In such cases, I'll go for hydrogel material. But if believe me, 90% of the patient they use the contact lenses for more than 14 hours. In such scenarios, I'll shift them towards silicone hydrogel. Now, how to shift? How we can explain the benefit to the end consumer or patients? First, I'll start with the first benefit, sir. This is silicone hydrogel. It passes more oxygen to your cornea. That's why you can use these contact lenses for longer duration of time. It provides you a better comfort throughout the day, even if you are using it for 14 to 16 hours. At the same time, these are better DK by T lenses, so it will not affect your overall cornea's health or eye health. It supports your eye health and keep your eyes more whiter and more clear. And a silicon hydrogel material, it is definitely convenient for daily use because the chances of deposit are also very less compared to hydrogel lenses. And that's why for the newer lifestyle or today's lifestyle, I'll suggest if I have to select the material, I'll start with the silicon hydrogel material. So I'll just show you a small video how the lifestyle is changing and how we can select the material. A very small video. Can anyone just confirm whether the audio is audible or not?
Yes, sir, audible.
Okay, great. Yes. So basically, the video shows that how the people are upgrading themselves, our patient are upgrading themselves in all other factors. They are upgrading their mobiles, they are upgrading their laptops, even the clothing styles they are upgrading. Then why we should stand back in contact lenses? And that's why it is necessary to upgrade or to suggest a latest material of silicon hydrogel or more healthy material of silicon hydrogel, which is suitable for their lifestyle. That's what the message we want to give through this video. Now we have selected how we can select the material. Now let's go ahead how we can select the modality of contact lenses, how we can suggest which modality is suitable. Now, if I have to observe the market, we have multiple modalities option available from yearly disposable to daily disposable. So in Indian market, we still have yearly disposable contact lenses. We have monthly disposable contact lenses. Some brands providing bi-weekly disposable contact lenses as well as daily disposable contact lenses. Now, believe me, for today's lifestyle, yearly disposable contact lenses are not suitable because of two specific reasons. First, they still manufactured with older material. They are not manufacturing with silicon hydrogel material. So if I have to observe the material of yearly disposable, it is still PMMA-like material, which has lower decay by T. Second, after uses of 2 to 3 months or 4 5 months, the chances of deposit is very high in yearly disposable contact lenses, which again increases the chances of infection to my eyes. And nowadays, even the hydrogen peroxide cleaning solution is not available in the market. So previously, when monthly or daily disposable option were not available, the yearly disposable lenses, we used to clean these lenses in 2 to 3 months with hydrogen peroxide solution. But nowadays, that option is also not available. So yearly disposable contact lenses are more harmful for my eyes as they have more chances of deposit. And that's why we majorly focus if I have to select the modalities. I'll select a monthly disposable, bi-weekly disposable, or the best is daily disposable. Now, what are the benefit of daily disposable? So daily disposable, I'll say it is a most healthiest option available in contact lenses. As simply we have to use the contact lenses for a day, then we remove it and then we throw it. So the chances of infection, the chances of deposit are very less in daily disposable contact lenses. Second, if I have to check for the today's lifestyle, the patient are more convenience centric. I'll give you a simple example. So nowadays, a majority of people are using a Zepto, Blinkit like services. They know that they have to pay 100 or 200 rupees extra for this service, but they are still using these services. Why? Because today's patient required more convenient and daily disposable fulfill that convenient factor. And for that convenient factor, patients are ready to pay. So that's how daily disposable is more convenient and best option to dispense any patient. Now, third, we does not need to carry any solution or any lens case. It's simply use and throw lenses. Or a simple statement I'll state for daily disposable is fresh lens every day. So it is more healthy, more convenient, and much better option for the today's patient. Now, if the patient finds daily disposable contact lenses are more expensive or the patient are more price sensitive, then I'll go for the option of FRP. FRP means frequently replacement product. So both monthly disposable lenses as well as bi-disposable lenses comes into a category of FRP. Now, compared to conventional lenses, the FRP lenses are better, provides better hygiene and provides or more safer option for my eyes. So even the newer material of silicon hydrogel, they provide me a consistent comfort compared to conventional lenses. Even if I have to check for the silicon hydrogel portfolio, it provides me a better health for my eyes. So even I can go for FRP category of lenses. And because of more innovation, better technology, even with FRP lenses, the chances of deposit are very less. So today's contact lenses or the newer contact lenses, they have very less chances of deposit. And that's why if I have to select a modality as well as material for my patient, definitely I'll go first dailies with silicon hydrogel material. This is my first choice. And if it will not work, then I'll go for FRP with silicon hydrogel. That will be my second choice. I'll ignore conventional lenses as well as hydrogel lenses if they want to use the contact lenses for longer duration of time. And that's how we can select a modality as well as the material for the patient. Now, the major factor how we can approach for the contact lenses. So, as we all know, in today's practice, the majority of patients they are happy with spectacle lenses and they are scared for to try contact lenses. And we need to push or we need to approach for the contact lenses. We need to introduce them. Sir, the contact lens option is also available and it provides you the specific benefit. So, how we can start the patient journey toward contact lenses? So there are four method or I'll say four stages. The first stage is start with the making them aware about contact lenses because majority of patient they are not aware about contact lenses. They have multiple myths in their mind. They think that the contact lenses are harmful. The contact lenses goes behind the eyes. So there are multiple myths. So we should make them aware for the contact lenses. So this is also an option available which will help you to fulfill your today's lifestyle requirement. Second, consider the portfolio or consider the product or consider the category which will help them or which will fulfill their requirement. Then we have to give commitment, we have to give trial. We can start with the trial lenses, give them the commitment, sir, try this contact lenses. This will majority of myth will get automatically will get reduced. Just try it, feel it, and observe the benefit by yourself. So commit this benefit to the patient. And last, if after commitment, after suggestion, adaptation is most important thing. So it is observed that around 40% of dropout happen in first 3 months of contact lens usage. So we have to make sure that the patient will get adapted for the contact lenses and they'll continue to use these contact lenses. By using all these four steps, we'll get a loyal patient. So let's understand all these four steps in detail. So let's start with awareness. So if I have to make sure that my patients are aware about contact lenses. So we have to grab their attention, we have to educate them, we have to prepare them, prepare their mindset for the contact lenses. And because of this activity, if I make them aware, the patient feel more interested towards contact lenses. Now, second, we have to recommend the contact lenses. We have to consider their lifestyle. Then we have to select the right contact lenses. So as we have discussed, we have to select the modality as well as material as per their lifestyle requirement. So selecting the right contact lenses make sure that our patients are more motivated to try the contact lenses. So we can motivate them, we can consider their lifestyle and suggest the contact lenses with pre-screening as well as at the time of eye examination or by teaching them how to use the contact lenses. Then, after giving trial, we have to give them the commitment as well with the help of continuous support. So, we have to teach them for the contact lens trial. We have to give them the time to use these contact lenses and share their feedback. So, we have to give commitment and we have to make sure that the patient is more comfortable with my first trial. And because of this activity, the patient feel more confident toward contact lenses. And last thing is the adaptation. So, in adaptation, after dispensing the contact lenses, the procedure will not stop. We have to take a follow up with the patient with feedback and with not only feedback, I'll say a continuous feedback after 3 months or after 6 months. So this will help the patient feel more understood, and it shares he will share the problem or the what things he want in contact lenses, and that's how we can even later on upgrade them towards better option. So initially, if I'm starting with the FRP, I have I have option with adaptation to upgrade them toward daily disposable contact lenses. So that's how we can create a contact lens patient journey. Now, the last factor is to how to select a perfect contact lens power. Now, everyone knows that there is a simple formula to convert spectacle power towards contact lens power. But this is much more difficult just to calculate every time. And that's why multiple option available in the market. We have multiple calculator. So I like to introduce an Opti Expert app, which you can use to convert a spectacle power to the contact lens power. This is the last step just to select a perfect contact lens prescription for the patient. It will help even patient to believe on us with the proper calculation. We can show them, sir, this is your contact lens calculation, and that's why your spectacle power and contact lens power differs. So that's how we can select a proper contact lens power. So that's it from my end, and I'll close my presentation with the single statement. Let's grow together and let's bring the Leonardo Vinci's small big idea to the life. So I'm open for any queries, any questions.
Yes. Thank you so much, Prashant. It was a wonderful session, and you covered modalities, materials, and the patient selection part very beautifully. I would
Thank
like to
you.
take a quick poll with the participants. Yes. So, has this session improved your knowledge on material, modality, and patient selection? Please type yes or no. You would like to see the results. And I was wondering when you said the silicon hydrogels were patented in 2000 year, and it's
Yeah.
2026 now, and still there are very few conversions or upgrades to the silicon hydrogel. And you
Well,
beautifully
hydrogel.
convinced actually all of us that we should definitely upgrade.
Yeah.
Okay, so I'm
Oh,
ending.
I think people were writing on chat box.
Yeah. Yes, wonderful. So almost 100% they've gained the
Oh,
knowledge,
great.
and that has improved their knowledge on material modality and patient selection. That's great. We have few comments in the chat box. Okay. Uh, Yes, Kani ma'am is saying wonderful presentation. How you go about
Okay.
with the prescription that's not possible in frequent replacement plan.
Okay. So basically, if I look at the power range availability, I'll specifically highlight the Cooper Vision because Cooper Vision has highest power availability. So your 99.9% patient will get covered in Cooper Vision portfolio. So I'll give an example. The maximum power available from plus 20 to minus 20 spherical. And even I can prescribe plus 20 with 5.75 cylinder at 5 degree, 10 degree, 15 degree at 5 degree step. Now in contact lenses plus 20 means or minus 20 means spectacles minus 23, 24 diopter. So you can cover majority of patient with FRP portfolio. I
Great.
hope it
Yes, yeah. I hope it answered your question, Kani ma'am.
yes.
Okay, next question we have from Shama. What about contact lens selection based on patient's eye power? So she means
Okay.
if, yeah, on the based on the prescription, how we can select the contact lenses.
Yes. So if I have to talk about the prescription, um, again with prescription, if I have to select the material, let's assume after prescription, the second part is selecting the material. And major difficulty with higher prescription is the thickness of the contact lenses. As the thickness increases, the chances of oxygen passing through the contact lenses is also reduces. And that's why if the prescriptions are smaller, around 3, 4 diopter or 5 diopter, I can select the basic silicone hydrogel. But if I have to select the contact lenses for the higher prescription or higher power range, I'll make sure that the contact lens have highest decay by T, more than 87 or more than 90. And that will make sure that even with higher thickness, it will fulfill my minimum requirement of oxygen permeability. So while selecting the contact lens for higher prescription, my first factor I'll observe for the decay by T. And nowadays, the majority of contact lens companies provides you the oxygen permeability chart also, which shows how much oxygen is passing through center as well as periphery. So if I have to just put the power and they shows how much oxygen is passing through overall the contact lenses from center, from periphery. So I'll make sure that in such condition, it will fulfill my minimum decay by T requirement.
Okay. Great. Okay, we have one more question. If the lens wearer is the first time wearer, what factors would you prioritize when you are selecting the lens?
Okay. So, majority of people, the problem, not problem, but habit with Indian market for first time user, they always go for price. So this is cheaper, you can go for that. But in reality, for first time user, definitely I'll first consider what is their lifestyle or what is their requirement. If their lifestyle is to use the contact lenses for longer duration of time, I'll go for silicon hydrogel material only. Now, second, for the first time user, I'll definitely not go for very soft contact lenses of zero point 0.4 modulus. I'll select the contact lenses of modulus zero point 0.6 to 0.7 because first time user, he is not aware how to handle the contact lenses. And the modulus of zero point 0.6, 0.7, it helps us to handle the contact lenses very easily. So first time user, learn how to use the contact lenses very fast as well as zero point 0.7 or zero point 0.8 is the optimum modulus. It does not create a very high awareness on my eyes also. So I'll select high decay by T lenses as per their lifestyle and a medium modulus of zero point 0.7 to zero point 0.8. That's how select the contact lens for first time use.
Okay. Okay, Prashant, can I ask you a question? Why you are not wearing contact lenses?
So I don't have a specific power. I'm
Okay.
using this photochromatic glasses. So in
Oh,
sunlight, it's gives me the effect of sunglass, and on desktop it gives me the blue light protection.
oh, okay. Great,
So
great.
So I'm still hoping the next development in contact lens, it comes with the blue light protection contact lenses.
Yes. Yes. Any other questions from the participants or any comments on the talk? All right. So no more questions. So I think as we are at the end of the session, I would like to thank Mr. Prashant Pawar for such a wonderful and insightful session. You gave so many practical tips, and your perspective on the selecting the right lens based on the material modality, and of course the patient profile has truly added value to our clinical understanding. And of course, we extend our sincere gratitude to Cooper Vision India for their support in making this session possible, and for their continued commitment to advancing optometry education. And all the participants, please stay tuned for upcoming activities with Cooper Vision India, education wise, hands on workshops, everything. So please stay tuned for that. OCI has released a newsletter today itself, so please check that on the OCI website and all the social media platforms. So thank you all to all the participants. Thank you for joining us today and for your active engagement. We hope this session has enhanced your approach to contact lens practice and will help you deliver better patient outcomes. So we look forward to your participation in our upcoming sessions. Thank you once again. Have a great day ahead. Thank you all.
Yes. Thank you. Thank you very much. And have a good day.
Good day. Yeah.